Thank you so much for the introduction, and also to HRB TMRN for the invitation to present on this work. I'm excited to talk about it. It's been a few years since we started the programme, so it's nice to finally see it complete. So just to set a bit of kind of a stage for what I'm going to talk about today, I'll be talking about the PROMETHEUS programme, which is a large national programme of research focused on studies within a trial to improve recruitment and retention in trials. It was funded by the NIHR through the MRC, and we recently published the final report in the NIHR HTA journals library, which you can see here. In this final report, what we decided to do was not just present the findings from the PROMETHEUS study, but also use it as a way to provide guidance for undertaking SWATs in a step-by-step way. So we hope this monograph will basically be a really good resource going forward for anyone interested in doing SWATs of recruitment and retention in particular, but also more generally. So that's the kind of like the meaning, the rationale behind this report. Just to give a bit of background for anyone who is new to the area of SWATs. A SWAT, or a study within a trial, is a piece of methodological research which is nested into another post-trial. SWATs can be randomized, so a trial within another trial, or they can be non-randomized, so they can use qualitative methods or observational methods. And they're all valid ways of doing SWATs. What we tend to focus on at the Trial Forge SWAT Centre are randomized SWATs. So today, my talk will centre around randomized SWATs of recruitment and retention strategies. Sean Treweek led the first Trial Forge guidance paper, which defined a SWAT as a self-contained research study that has been embedded within a host trial with the aim of evaluating or exploring alternative ways of delivering or organising a particular trial process. Why do we need SWATs, you may ask? We need SWATs because they're the most rigorous method to test strategies to improve trial conduct. So you're testing strategies within real life trials rather than hypothetical trials. SWATs are really useful, and they're actually surprisingly conceptually simple, and they're generally cheap, and I'll show you some of the costings that we came up with further down the line. And they help to generate evidence to reduce research waste, which is currently a really big problem and has been for a very long time. Also for members of the trial team, for example, those who don't necessarily get an opportunity to lead on publications, they're a great way to get extra publications. So within our team at York Trials Unit, we often have trial coordinators or other members of the trial team who engage in delivering the trials, actually lead on doing SWATs, and so that they can lead on writing the papers on SWATs and publish them. So they're great for building up publications and other people and people's CVs, especially those who may not have opportunities to do so normally. Also, we need SWATs because we need more robust evidence about how to do trials. And when we do have more robust evidence about how to do trials, we need to then start using this evidence. There's been some studies that show that actually we tend to do trials in the way that we've always done them, rather than using the evidence to inform how best we do them. And so we need to start changing the way that we run trials. There are some key features of a SWAT that I thought I wanted to highlight. So a SWAT will aim to resolve uncertainties about how to do a trial. They are embedded within a host trial, but they don't affect the integrity of the host trial, and that's really important. SWATs should have a formal protocol, just like the host trial. And individual SWATs can contribute to systematic reviews of SWATs. So we're currently updating the Cochrane systematic review of recruitment strategies. In there, we've identified a lot of individual SWATs that we'll use and hopefully meta-analyze. And SWATs can be evaluated in a single trial, but ideally, to generate more robust findings across different trial contexts, we prefer that it's run across many trials. Now, SWATs will inform how we do future trials, but it might also inform decisions about the actual host trial itself. So within your trials unit, we tend to do, we've done quite a lot of SWATs during the internal pilot or feasibility stages of trials, which we then use to make decisions about the full-scale definitive trial. Prometheus focused on recruitment and retention into trials. And the reason for that are many. We know that trials are important, but recruiting and retaining enough participants is often very difficult. In the UK, we've only 43% of trials recruit on time and to target, which means that the vast majority, well, the majority of trials either fail or they have to go back to the funder to ask for more time and or more money. It also, if you can't recruit enough people and retain them, you're more likely to have reduced power, so your sample size reduces, and you risk, the host trial risks coming up with type 2 error, which means that there isn't enough power in the trial to identify any meaningful effectiveness in the strategies when the strategy is actually effective because the sample size is too small. It also affects the external validity of trials. During the COVID pandemic, many of you will have heard about the recovery trial in the UK. It's a large trial platform, and it was a great trial because it tested a range of different trial treatments, and it was set up, I think, within about 10 days from kind of being from the decision being made to start the trial to actually recruiting the first patient. So it was amazing, and it's generated a lot of really useful findings which have been implemented. In two of my colleagues, Catherine Norson and David Torgerson, looked at the dexamethasone of the recovery trial, and they calculated that for every 50-day delay in completion due to slow recruitment or retention, this led to about 450 more deaths in the UK alone. So slow recruitment in trials, even for slow recruitment in trials has a human cost. So we need to kind of start thinking about that in terms of not just, being difficult, but actually it does have significant human cost. There are also economic consequences. So work undertaken by a PhD student of mine, actually, no, he's past his viva. So Dr. Nassas Gekas, he has shown that faster recruitment to the recovery trial, especially in the dexamethasone arm, from 15%, which is what it was, to 50%, could have generated an incremental net benefit to the UK of £17.2 million, or just over 20 million euros. So again, there are financial costs to this. So poor recruitment and retention cause huge amounts of research waste, and there are also massive opportunity costs. It delays evidence to improve treatments for patients, and also prolongs exposure to ineffective or dangerous treatments. The Prometheus project, so Prometheus stands for Promoting the Use of SWATs, was funded by the UK National Institute of Health Research. Although we mostly dealt with the Medical Research Council, so the NIHR gives a budget to the MRC to fund this methodology programme. It's led by Professor David Torgerson at the University of York, with co-applicants from 10 clinical trials units in the UK, as well as Primary Care Centre, and we're very lucky to collaborate with HRB TMRN, specifically Declan Devane and Sandra Galvin as co-applicants. And Prometheus aims were to embed randomized SWATs to test commonly used recruitment and retention strategies for improving recruitment and retention. We wanted to provide coordination of SWATs to then push the agenda forward. The aim was to pump, prime, and facilitate 25 recruitment and retention SWATs across multiple clinical trials units within 30 months. And we wanted to test their effectiveness in the context, not just of a single host trial, but also across different trial populations and contexts using meta-analyses. And we wanted to make SWATs routine when doing trials. In terms of the methods that we use for Prometheus, we first created a priority list of recruitment and retention questions, which we updated as the project went on. We got patient and public involvement input into the prioritization, which I thought was really important. We then developed SWAT protocol templates for testing the priority questions. And then we advertised for trial teams to apply for funding of up to £5,000 to test one of our prioritized questions, or they could test their own. The aim was just to pump prime the activity of doing SWATs around recruitment and retention. And ideally, host trial teams would select one of our prioritized questions, but if they felt they had a strategy that they felt was more important for their trial, then we would support them to test it. Each funding application for a SWAT underwent independent peer review from two peer reviewers who were co-applicants on the Prometheus program. Successful applicants were given not just funding, but methodological and process support to embed and report their SWAT. The intention, I did this, and then I realized that actually I hate it when other people do it, and yet I did it. It's not to just go into detail about the list of recruitment and retention questions that we prioritize, but just to give you a flavor. So we had 7 recruitment strategy questions and 8 retention strategy questions. In terms of continuing on the methods, to allow meta-analysis, we developed a standardized protocol for the SWATs, and then we also developed a statistical analysis plan, which we shared with the host trial teams. Each SWAT obtained approval from the host trials research ethics committee, as well as institutional governance as was needed. From each trial team, we asked for anonymized individual patient level data on recruitment and/or retention to be shared with us securely when the data were collected. Where patient level data wasn't available, we would accept summary data by group. So, in terms of the results for the SWATs, we screened 66 SWATs for eligibility and ended up excluding 24 SWATs for various reasons. We then funded 42 SWATs. Our funding was our goal was to fund 25 SWATs initially, but we actually exceeded that significantly. We had these 42 SWATs in 31 host trials, and I'll talk more about the individual SWATs in a little bit. There were 13 clinical trials units, and of the SWATs, there were 4 that were factorial in their design. I can discuss that a little bit as well. And we had a bit of a problem, like the rest of the world, with the COVID pandemic, which impacted on some of our trials. There are also a couple of technical issues with a couple of our trials, and in total, we expect data to be returned for 36 SWATs. In terms of the results of the actual SWATs, the mean cost per SWAT was £3,535, which is about €4,000. So it was less than £5,000, so we were able to fund more SWATs. 12 of the SWATs tested the same SWAT strategy across multiple host trials using a coordinated, simultaneous SWAT design. I'll talk about that in a little bit. And 2 recruitment and fire retention questions were tested in more than one host trial. As I mentioned, the pandemic had a negative impact. 2 SWATs ended up being terminated, and 10 of the SWATs, although they continued, were delayed significantly. In all, Prometheus will add 18% more SWATs to the Cochrane Systematic Review of Recruitment Strategies and 79% more SWATs to the Cochrane Systematic Review of Retention Strategies, which for a project that was funded just over 30 months, and the cost for Prometheus was just over £260,000, which is about 300,000 euros. I think has added a lot of value. In terms of, again, the detailed findings from Prometheus, we sadly could not identify any evidence of a significant difference for any of the strategies that we tested for recruitment. And this has tended to be the case for a lot of the other SWATs that have been done in the past. So it seems that recruitment is particularly difficult to do in terms of finding strategies that can actually be significantly shown to be effective. For retention, we found that pre-notifying participants by card before sending them questionnaires was effective for improving response rates. So yeah, so that's great. We also found that pre-notifying participants by letter or email was effective. Again, that's great. We found that sending personalized text messages was more effective for improving the return of postal questionnaires compared to non-personalized text messages, and resulted in fewer completions via telephone. So people who didn't respond then got called by a member of staff, and obviously that takes quite a lot of resource to do. So yeah, we'd now recommend sending personalized text messages. We also found that including a pen with a questionnaire that you send by post probably increases retention and response rates as well. What we found, we did also find things that should not be done. So the first one is, if you want to improve retention, don't send a Christmas card to participants, especially by post. The pooled odds ratio of that was 0.96, so reduced retention rates. And this is based on 8 SWATs. It also costs money and staff resources to do, and is bad for the environment. So the average cost per card was 140 grams of CO2, which is not negligible. We also found that one of those trial teams that we worked with suggested sending follow-up questionnaires, randomizing sending follow-up questionnaires to be printed on pink paper versus white paper. And yeah, the finding from that is that don't print follow-up questionnaires on pink paper, which showed that sending it on pink paper decreases response rates with a risk ratio of 0.92. And that was also more burdensome to collect postal data in the pink paper group, so don't do it. Aside from those findings that I've just talked about, we also in the report talk about some of the lessons learned, so I'll go over some of that here. If you've got any questions as I'm talking, please do write them in the chat so we can discuss them later. So when you're doing a SWAT, just to start off with, you need a host trial. So a trial that you'll embed your SWAT in. Often this is pragmatic. In Prometheus, we worked with a number of clinical trials units who all had a number of trials within them, and they're committed to doing a SWAT. But if you're an individual researcher wanting to do a SWAT, you would probably do the SWAT in your own trial, or if you know of a collaborator or a colleague who's doing this trial that's compatible with your idea for a SWAT, then that's usually the way to go. So it's quite a pragmatic way of identifying host trials. In terms of costs, we found that costs can vary. So they range between €3,500 to more than €35,000 for a single randomized SWAT. And costs will, and it will cost a lot more for a program of SWAT. So as I mentioned, for Prometheus, it was about €300,000. Other programs of SWAT will cost significantly more than that, depending on what the nature of the work is. But one of the key lessons we learned was that there needs to be, there is a need for transparent costs around SWATs. Subsequent to Prometheus, we have been lucky to get some funding from HRB TMRN to update and extend Trial Forge Guidance 2. And the focus of that will be to reduce, to try and reduce research waste by considering the cost effectiveness of undertaking further SWATs on interventions, and we'll develop some tools to support trial teams to be able to do this going forward. If you're a trialist and you're thinking about doing a SWAT, you'll need some funding. HRB, the TMRN has a really lovely long record of funding SWATs. And I would certainly recommend going to that route if you're based in Ireland. In the UK, we've got the Medical Research Council and the NIHR who work together to provide methodology funding as well. The NIHR, on top of funding the MRC's methodology research program, also recently have extended their use of SWAT. So they originally, back in 2018, when Prometheus first started, did a trial where they asked trial teams who were applying for funding from the HTA program to bid for up to £10,000 to do a SWAT. Recently, the NIHR have rolled out this funding across all of their programs, bar the I4I initiative, where you can't possibly embed a SWAT. And they've also increased the amount of funding they offer. So now they fund up to £30,000 to do a SWAT. So if you're applying to the NIHR in the UK for funding, do make sure to put in for a SWAT. We've also developed guidance for the NIHR on their website to support trial teams to actually word their funding application around the SWAT that they're doing. And there's a link later on that I've included. In Canada, the Canadian Institute for Health Research have now started to think about funding SWATs. So ACT was the first, so the Acceleration Clinical Trials Initiative did a SWAT funding launch last year, and they've subsequently funded the other SWATs. And the Canadian Critical Care Trials Group has also funded at least one SWAT that I'm aware of. So there's progress being made, but there is much room for other funders to actually start getting involved in this because it's very important. In terms of guidance, we think that trial teams should include PPI when planning their SWATs, much in the same way as they do for their main trial. And we recommend that trial teams include those who would potentially be impacted by the strategy being tested. So obviously patients, but also, carers or, or recruiters. Anyone who will be impacted by the strategy being tested in the SWAT can be considered a patient and public partner, and their thoughts should be sought. PPI members can include potential participants, but unlike for host trials, PPI for SWATs can include enrolled trial participants, which I think is really interesting. It's also especially useful to identify novel or to adapt existing strategies to your actual individual trial. if you ask your patients in your trial how best they can adapt that strategy for that particular trial. I know there are quite some issues with finding PPI partners. For SWATs, targeting participants or potential participants, I would suggest approaching the PPI members for the host trial. And then for strategies targeting staff, approaching the staff undertaking recruitment strategy is also a good strategy. In the UK, I know less so for Ireland, there is a website called People in Research, which is funded by the NIHR, and it's got a database of people interested in PPI members interested in getting involved with researchers. And when I've used it in the past, we've identified a lot of people who've been very interested in being in taking part in our studies. So that's one potential way to go. Although that pool of people tend to have a lot of experience on trials. So if you want people who are not so experienced in trials, it might be better to go down the host trial route. And guidance on developing SWATs. So there's a need for clear research priorities on SWATs, particularly randomized SWATs of recruitment and retention strategies, especially ones which are updated. We've done some work on this, and I'll show you a link in the next slide. Priorities should be presented alongside estimated costs, resource use, and if possible, a protocol. That's what we found. And subsequent to PROMETHEUS finishing, we've been, again, very lucky to get additional co-funding from the HRB TMRN and the MRC NIHR to develop protocols and resources for prioritized recruitment and retention strategies, which we are currently working on, and will be hopefully presenting the findings of that at the International Trial Methodology Conference. Tools to help trial teams identify strategies suited to their host trial and patient groups are needed. We're starting doing some work on this, but I think a lot more work needs to be done to actually do this to support people wanting to do SWATs. And there's also a need for communication as to when no further SWAT replications are needed. It's not such a problem now, but there will get to a point where once we got enough evidence, we don't need any more. And to avoid research waste, we need to be able to have a way for trial teams to learn to know which SWATs they should and shouldn't do. TrialForge, including the TrialForge Guidance 2 update, will help with this. Implement SWATs is also doing some work around that. And in terms of choosing your SWAT question, I go back to the Cochrane systematic review of recruitment strategies, and the systematic review of retention strategies led by Katie Gillies is also very similar in terms of its findings. Here it says, the literature on interventions to improve recruitment to trials has plenty of variety but little depth. So there's lots of studies being done, but very few replications. So we don't actually know what works definitively in what context. So what we stress is that it's important to replicate existing SWATs or follow prioritized lists. Increases the power and the generalizability of your findings. So if you're wanting to choose a SWAT question, we have a prioritized 11 recruitment and retention questions to be tested using a randomized SWAT approach. This was informed by a literature review of the strategies that actually trials use in real life rather than it being top down. We also identified the strategies prioritizing priority 1 and priority 2, and the repository of SWATs to come up with this list. So if you're wanting to choose a SWAT question and you want to do a randomized SWAT, the first step would be to use the 11 priority list. If it's a non-randomized SWAT, or there's a SWAT on there that you don't particularly think works for your trial, then priority 1 and priority 2 are great. And if you're not sure about the method, or it's a non-randomized SWAT that you're thinking of, then they're both excellent, priority 1 and priority 2, for identifying which strategy to go for. The 11 questions that we came up with are very focused. And then there's a repository of SWATs as well. So if you're doing a SWAT, register your SWAT so others can link in to what you're doing. And if you want specific advice about which SWAT might work for your trial, you can contact our Trial Forge SWAT Centre at York, and we're very happy to discuss with you what might work. In terms of guidance for funders, I'm not sure if there's anyone from funders on this call, but I think that even if there aren't, I think trial teams should probably also know what advice we're kind of targeting specifically at funders. And it's that trial teams want to know that they're doing a SWAT that's necessary and relevant to increase the evidence base, and that more funding is needed to develop these types of resources so that they know how to use them. Also, that when applying for funding, trial teams need to say whether the question they're addressing is a priority question and give a clear rationale for choosing that question. Where we've worked quite a lot with the NIHR in the UK, and this is one of the things that we're hoping to continue working with them on as well. And if there are funders, say in Ireland, who are interested in this, then we're very happy to discuss with you as well. In terms of design choices, individual randomized SWAT designs are often really straightforward and they're efficient. One thing that we found in Prometheus is that factorial designs are also quite appealing. We've done a few 2x2 factorial SWATs that can test the effectiveness of two strategies at the same time. They're even more efficient than individual randomized SWATs. And you can test for interaction effects to see if one thing adds to another or takes away from another. So in the OTIS retention SWAT, what we did was we included a pen, no pen, with or without a cover letter containing a social incentive text. Cluster randomization can also be done. Because cluster randomization ends up with a design effect, it reduces the sample size. So we try not to do that where we can avoid it, but it can be actually really feasible for practical and logistical reasons in terms of reducing the burden on trial teams. So it's an option, and we've used them. So do use cluster randomization where you can't use individual randomization. Cluster randomization also minimizes contamination and dilution between the intervention and control group participants, depending on the strategy that you want to use. So it can be useful. One of the things that we learned in Prometheus, which we didn't actually originally plan to do, but it came about because we had more funding and we had the opportunity to do it, was to test the feasibility of doing SWATs simultaneously across multiple trials at the same time. So instead of one trial, doing the SWAT in one trial, you do the same one across lots of different trials. And it leads to bigger, better and faster trials to develop rapid, high quality evidence at scale. The first one we did, we collaborated with the Quintet team at the University of Bristol. They developed a training workshop for staff recruiting participants. And so we recruited four host trial teams to test the feasibility of doing a simultaneous SWAT. And we found that it was feasible to do a simultaneous SWAT, which was really good. And then the next one we did was a simultaneous SWAT across 8 host trials, where we tested the effectiveness of sending Christmas cards on participant retention. We were very lucky to have this published in the BMJ Christmas special. And for me, it's probably the highlight of my career to have a paper published in the BMJ Christmas special. Simultaneous SWATs are great if we can do it, but they require significant coordination and organization to be able to pull them off. So a lot more resources needed to be able to do them. In terms of when to embed a SWAT, the earlier the better and the earlier the easier. So we tend to often plan SWATs at the design stages of our trials, but actually you can embed a SWAT at a lot of different stages in a trial. So we say it's never too late to embed a SWAT. So for example, you can do a randomized SWAT testing and retention strategy up to the very last follow-up time point in a trial. So you can have plenty of time. If you do a SWAT, you should register it. The Northern Ireland Hub for Trial Methodology research has a SWAT store. There are now well over 200 SWATs on there. And if you're doing a SWAT, add it on there because it makes it easier for people to find what you're doing and also replicate it or adapt it to replicate it. So in terms of guidance for governance approval for SWATs, SWATs are low-risk studies, but most SWATs will need ethical approval because they tend to involve people, often patients. So for recruitment and retention SWATs, patients are not usually, or participants are not usually informed about being included in a SWAT. This is because it's not possible to get individual consent often, as it may confuse them as to what we're asking them to consent to, and it may also impact their behavior. Often strategies to improve recruitment and retention aim at participants' behavior, which is to either enter the trial or complete a questionnaire. And if they know that we're doing the SWAT, it can change the behavior and impact on the SWAT itself. If you're not going to inform participants, and we've tended not to, it's useful to get PPI input on this. We've also found that journal reviewers tend to query why we've not got individual informed consent from participants for these SWATs. We always get ethics approval for this, and we always make it very clear that individual consent is not being asked for from participants. But at the point of publishing the journal, we've sometimes, not often, sometimes had queries about why we haven't provided informed consent. We have worked with the HRA, the Health Research Authority in the UK, to develop a streamlined approval processes and guidance for SWATs, which we included a copy of as an appendix in the Prometheus final report. So you can have a look there, what that looks like. But essentially, it groups different types of SWATs into, there's like a risk assessment of different types of SWATs, and some need more detailed work to get approvals than others. In terms of sample sizes, for some SWATs, for example, for recruitment, the sample size for the SWAT will actually be much larger than the host trial. So if you're doing a trial in cancer, and you're inviting, or cancer prevention, and you're inviting, say, you want to recruit, I don't know, 500 people, you may have to approach double, triple, quadruple the number of people to actually get your sample size. And the sample size for the SWAT isn't that for the host trial, it's a larger number of people that you recruit. So actually, for recruitment SWATs, the sample size can be quite large. Other SWATs are constrained by the host trial sample size. So if you're doing a follow-up retention SWAT and you've got a sample size of 400, which is probably average in the UK, your sample size for the SWAT will be a maximum of 400. And so a separate power calculation may not be useful because your sample size is what your sample size is. And for SWATs, we're not particularly concerned about the smaller sample size because the whole point of it is to actually look at the difference within the trial and across different trials. So meta-analyses of several trials or SWATs testing the same intervention can provide powerful evidence. In terms of randomization and analysis, randomization can be separate to that used for the host trial randomization. At our unit, we tend to actually keep them separate. Our database team kind of get a bit angsty about it, and it's just much better and cleaner and more controllable to actually just keep it within the SWAT team and do it separately. But obviously we also stratify, so we do stratify, especially for retention SWAT. So we do have often have some background information. We consider the background information before the randomization. Individual randomization is preferable, like we say, but not always practical. So cluster randomization can be used. And for the analysis, it's actually relatively simple. for the primary outcome, because you're comparing two proportions. In terms of reporting SWATs, we have produced guidelines for reporting randomized SWATs, which was work that we did as part of Prometheus. And that's been published here. And I've put a link in the resources section as well. And if you're doing a SWAT, please share your findings with me so I can include them in future updates of the Cochrane recruitment and retention reviews. I've been in a very lucky position of being funded, following on from the Prometheus project, for a program called Implement SWATs. And Implement SWATs is doing a number of things, but one of the key things it's doing is updating the Cochrane systematic and review of recruitment and retention. And as the evidence builds, we'll turn these reviews into living systematic reviews that are constantly updated. So please do share your findings with me. And just to talk about Implement SWATs very briefly, it's a 10-year NIHR Advanced Fellowship. So it's a personal award, but alongside that, I've got quite a large project which is focusing on using implementation science and studies within a trial to improve evidence-based participant recruitment and retention in trials. The website's here, so you can have a look. And the aim of Implement SWATs is to test the effectiveness and cost effectiveness of routinely used and promising recruitment and retention strategies using the simultaneous SWATs that we tested in Prometheus. So it's building very much on Prometheus. And we also want to develop, implement and test guidelines for evidence-based recruitment and retention in trials. So once the evidence becomes available, we then want to be able to find a way that trial teams can use them. It's got 5 different work packages. Work package 1 identified and prioritized routinely used and promising recruitment and retention strategies. That's on the resource. We've done that, and that's on the resource link, where we developed the 11 strategies for recruitment and retention. Work package 2, which we're working on at the moment, is we're undertaking simultaneous SWATs of the highest priority recruitment and retention strategies. And we are focusing on financial incentives, which have been prioritized. So we don't know, we think financial incentives are often used, but we don't know what are the most effective strategies, how much is effective but not too much, and whether cash is better than vouchers. And so we're testing a series of questions around that. Work package 3 will develop and update guidelines for evidence-based recruitment and retention. Work package 5 will develop an implementation strategy for the guidelines, and then work package 5 will test the implementation strategy. So it's a long-term project over 10 years. And just skipping ahead briefly, the simultaneous SWATs that we'll do will focus on the monetary incentives, and the aim is to rapidly build the evidence base for the effectiveness and cost effectiveness of monetary incentives for recruiting and retaining trial participants by undertaking simultaneous SWATs alongside a process evaluation. And the questions around, what are the optimal values? What's the optimal format, cash versus payment card versus voucher? And the incentives will be relatively small, probably ranging between £10 and £50. The first SWATs that we've done have focused on £10, in different formats. And the method will use an adaptive design. So we'll start off relatively low, and then strategies that show promise will be retained for further testing, and strategies that are shown not to be effective will be dropped. So we'll kind of develop the different strategies and adapt them as we go along to try and identify which work best. Very briefly, for host trial teams that don't have funding already, we can provide funding of up to £10,000, and they can randomise to begin with between a £10 cash, voucher, a payment card, or no incentives. And we ask that trial teams do at least 2 arms. And for some trial teams already have funding to do SWATs, so we're asking them, if they do have funding, to consider the different types of forms, so whether to use cash, vouchers, or payment card. And we're also asking host trials to consider, if they prefer, different values, so higher amounts of the same versus lower amount of the same thing. So, for example, lower amount voucher versus higher amount cash, and so on and so forth. And the outcomes are for recruitment SWATs is recruitment rates, very similar to Prometheus, but we'll also look at cost effectiveness, and we'll look at process evaluation as well. For retention SWATs, again, it's retention rates, and again, we'll look at cost effectiveness. And where possible, we'll also look at different patient populations, so age, sex, ethnicity, geographic location, and deprivation. To be eligible for host trials, they have to use individual randomization, and for retention, they have to have at least one follow-up remaining. And if they have incentives already costed into the SWAT, then we can give up to £5,000 to cover their costs. If they don't have any funding for the SWAT, we'll give them up to £10,000. The requirement is that it's a UK funder or recruiting participants in the UK. If you're in Ireland and you're putting in a trial funding application, please consider putting in this SWAT. I'll be very happy to help you put some wording in your application. And these are the resources here. I'll send a copy of the slides, and thank you very much for listening.